Welcome to Flip Your Script, the podcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine and serve as Chief Medical Officer for Nudge Health. Each episode delivers 5 key takeaways from leading experts and practitioners on how lifestyle medicine is reshaping the future of healthcare. Through practical strategies and real-world success stories, we empower you to make a lasting impact in your practice and beyond. In this episode, we are honored to be joined by Kaitlyn Pauly. As Chief Integration Officer of the American College of Lifestyle Medicine, Kaitlyn supports the education, practice advancement, and research teams who develop and integrate high-quality lifestyle medicine education, training, research, resources, and support tools across academic institutions, health systems, workplaces, research networks, risk-bearing entities, communities, and other stakeholders across the healthcare ecosystem. She also supports the advancement of the field of lifestyle medicine by raising awareness about key challenges and barriers to successful lifestyle medicine implementation, including those linked to payment incentives, quality measure misalignment, and structural support. Prior to her role at ACLM, Kaitlyn served in clinical weight management and bariatrics, corporate wellness, higher education, and the whole health department at Veterans Affairs. She's passionate about applying the principles of lifestyle medicine in her own life. Welcome, Kaitlyn. How are you doing today?
Thanks, Padmaja. I'm doing wonderful. So lovely to be here with you.
Yes, I'm so glad that we finally get to talk even here on this episode. So tell us about your journey to American College of Lifestyle Medicine. What first drew you to this community, and what inspired you to make lifestyle medicine part of your professional mission?
Sure. Well, I started my career as a bariatric and weight management dietitian, and I really loved my patients and supporting both our non-surgical and pre- and post-surgical programs. But I quickly realized that I wanted to be a lot more proactive in helping people before they got to that point of needing surgical interventions. So I transitioned to the employee wellness side of things, working for the Wellness Council of America, which is actually where I first learned about ACLM. ACLM was a strategic partner of ours at the time. And I remember being really impressed by the mission and bringing lifestyle medicine into healthcare. And so with our partnership, we ended up having a booth swap. So ACLM had a booth at our annual conference where I met Susan Benegas, our current CEO, and Martin Toll, our Chief Impact Officer. And I then attended ACLM's annual conference and was just blown away by seeing the physicians and health professionals that were using intensive therapeutic lifestyle change and team-based approaches to achieve disease remission and improve health outcomes. So I was really inspired to see what I kind of thought was true healthcare being delivered at the ACLM conference. Shortly after, I also started to see where the employee wellness side of things was falling short of where I had hoped. It felt like the programs were kind of embedded into employee benefits programs that were often targeted to people who were already interested in being healthy, and not really used by those who needed the interventions the most. And so, and I realized not many organizations were really investing in true culture change to make being healthy at work the default,
right?
Through the environmental shifts and policy changes that were necessary to do so. So I guess in my early career, I wasn't patient enough to wait for change. So I decided to move over to the VA Medical Center, where I had done a lot of my dietetic internship rotations. And I had the opportunity to join their whole health team, which was just getting started at the time, their flagship site in Omaha, Nebraska. So I had the great pleasure of being a part of that program for a little bit. And I had always maintained contact with Susan over the years, and I was planning a big move. And so I guess that led me to kind of reach out to ask, hey, is ACLM hiring? I knew they were remote. And it just so happened that they were. And they were wanting to hire an associate director of membership and education to help create infrastructure for the member interest groups. So those were a priority of Dr. George Guthrie during his presidency. And so that's where I was hired, 7 years ago now, to really offer support and create tools and resources for our members to really enhance care delivery. And, if you've gotten the chance to engage with our members and our community, you'll understand what keeps people here.
Yes.
We have some of the most altruistic human beings, I think, on the planet that make up our membership and leadership. And so it's just been such a wonderful journey, and to see the success of lifestyle medicine and have any part of that has been so great. And I'm grateful for every day to have the opportunity to do that. And I can't dismiss the role that Susan Benegas has had in all of this as a phenomenal leader and someone who is just very inspiring day after day. Even when it gets hard, she kind of keeps us all working toward the goal. So that's how I landed here.
Yes, and so very well said. I couldn't agree more about our community in general, our members, our leaders, and obviously our champion, Susan Benegas, who's really sort of a glue that keeps us all together in this community. So I know you've been deeply involved in practice advancement at ACLM. What has driven your commitment to ensuring clinicians are supported financially, and how has that shaped the way you approach your advocacy and implementation work?
Yeah, great question. This actually goes back to my first role as a bariatric dietitian, where I became a little disillusioned by the healthcare system, but I quickly learned, my patients had access and full coverage for bariatric surgery, but not nutrition and physical activity interventions or just basic lifestyle services. And I couldn't get over how backwards it was to pay for a disease once it's already at an advanced stage with a very costly, high risk procedure, when there's so much opportunity to help people before they get there or along the way with other lower cost, less risky interventions. So not that surgery doesn't have its place, it absolutely does, and medications as well. But I just thought there was this big gap in healthcare. Right. So, but that's not where the money was. And in fact, our bariatric surgery carried our other weight management and wellness services financially. So I realized that without coverage and payment, lifestyle services just wouldn't thrive. Patients wouldn't have access to the services. Providers wouldn't be able to deliver them sustainably and have leadership support. So that realization, which is still sometimes part of our current reality, is really what motivates me to keep pushing forward and come back day after day. That and making our clinician members' lives easier with tools and resources, information, because I really care about our members and the work that they're doing. And I care that patients have access to lifestyle medicine. I think it should be a right that everyone should have at least the option. Even if they choose not to engage with a lifestyle medicine service, they should have the option, and insurance should cover it. So,
yeah, and I have to acknowledge you've done such remarkable work in terms of developing so many resources over the years to support our members, especially around practice advancement, reimbursement toolkits, patient-facing resources, and so forth. So thank you for all that hard work. It has definitely helped each and every one. I know there have been many iterations of those, and we continue to make it better. But obviously, it really helps the practice of lifestyle medicine in real world. So I know lifestyle medicine often challenges. There are we often see a lot of resistance among clinicians, administrators, payers, and across the board. What have you learned in your journey as you have been working in this field, and more around some of these implementations, as well as advocacy work, especially around the resistance that we acknowledge on a regular basis. People not wanting to really either believe in lifestyle medicine or its efficacy of it. So how have you tackled that?
Yeah, great question. So in the beginning of my time here at ACLM, I feel like there was a lot more skepticism.
Yeah.
Despite the fact that most clinical practice guidelines list lifestyle as an intervention, as a first therapeutic approach for chronic conditions. And, most chronic conditions, there are like four lifestyle factors that contribute to most of our chronic conditions in America. So there was just not a general belief that lifestyle medicine was effective, feasible, or scalable when I first came here, which I thought was just so illogical. But over the years, that's really changed. I think COVID had a lot to do with that. It really just increased awareness of chronic disease and how bad it was in America, and that it often contributed to worse outcomes for COVID patients. So that, and then through just a combination of time, hard work to educate people, growth of the field and interest. And then I feel like there's just more of a social general acceptance of the connection of lifestyle and the direct role of chronic conditions. So that, and then embracing by many innovative organizations, academic institutions, and partners. I think I heard a stat just today that we have over 700 partner organizations, including, risk-bearing entities and health systems and academic institutions. So our network is huge and growing, and lifestyle medicine has become a lot more credible in the field. So we're now recognized by the AMA as a medical specialty. We have 2 seats in the House of Delegates. We continue to see increases in the adoption of our residency program, which is now, I think, over 250 locations across 450 programs. Our curricular resources and CME-CE. Just a fun stat, when I first joined ACLM, our LMRC program was at 4 locations. So just to see that growth, I think that really, as reputable organizations adopt lifestyle medicine curriculum and clinical practice, you just see just a general kind of acceptance that this is the right thing to do, and it's evidence-based, and it's, now we just need to figure out how to get it done. So I think all of that has really helped increase the acceptance and recognition. On the advocacy side of things, I feel like it's just been a lot of door knocking, and you know this very well. We continue to just keep going back and reinforcing and changing the language and talking to different stakeholders. But I'd say in general today, it seems very rare to experience the type of pushback that we did in the very beginning of this work when I first started. I think most people recognize the importance and efficacy of lifestyle medicine. And it kind of feels crazy to me that there was a time where we did experience resistance, but every once in a while we come up against it again, and we have to remind ourselves that some people just aren't as far along on their journey of lifestyle medicine knowledge and awareness. So.
That is so true.
Yeah.
So you have supported the work we have been involved in the last several years in national advocacy and real-world practice transformation. When you look back over the last few years, what's the biggest script you had to unlearn about how healthcare change actually happens?
Yeah, this is a great question. I think, in the beginning, we're all naive to think if you show good outcomes and give great healthcare, you can influence change in any organization, and having programs and services that demonstrate better health outcomes and delivering great care is just enough to change healthcare. And then, I think it's our beloved Dexter Sherney who always said, follow the money.
Yes.
Which goes back to the earlier point that without alignment of payment and quality measures, and kind of like the removal of some of those other barriers, there's just not going to be an ability for lifestyle medicine to truly transform healthcare and be available for all people. So it really takes that cultural shift, which includes the clinician education, research, patient empowerment, designing a payment and reward system that really makes lifestyle medicine integral to care. Whether it be added as a perioperative element or an intensive lifestyle program. I think just recognizing that there's so many different areas that you have to tackle to get that cultural shift, and that we're still in a sick care system in a lot of ways, and we're all fighting the good fight, but I think it just takes a lot longer, a lot more resources and effort than I would have ever thought it would take to change healthcare.
Yes, alignment. I think that's the key here, right? Incentives must align for everyone to win. Otherwise, no one is interested in those conversations. So, well, in closing, as you look ahead, what excites you most about the future of lifestyle medicine? And what do you see on the horizon that gives you the greatest sense of hope and possibility?
Yeah. Oh, so many things. I think most recently, seeing the CMMI models, we've had some amazing new models that have come out in the past couple of months that all list lifestyle medicine within them in some way, shape, or form, especially the Maha Elevate model, where they're really looking to test lifestyle medicine interventions. So the progress we've made with CMMI and our friends, and I'm saying we because I'm including you in this, I don't think we could have done any of this without your support and leadership in all of this. In addition to CMMI, in the physician fee schedule, the most recent one, we did see, there's now a code for nutrition and physical activity assessment, which we've been asking for. So some kind of recognition that this is an important piece or element to being able to transform healthcare. And then we saw an RFI on the prevention and management of chronic disease, where they asked great questions about intensive therapeutic lifestyle change and medically tailored meals and health and wellness coaches and motivational interviewing and physical activity. So I'm hopeful that we're going to continue to see more of this coming out from CMS and CMMI, because we know that it's their goal to help empower patients and transform health and healthcare and tackle chronic disease. And it's really exciting to see that kind of coming from CMS. So that's one of the most exciting things, along with the Rural Health Transformation Project. We were excited to see some states have decided to write ACLM into their RHTP applications, and they've now received funding. So to think that states could have, up to 6,000 clinicians trained in lifestyle medicine, and wow, that make a big difference in the way people receive healthcare in certain states. So just exciting to know that that's on the horizon and a potential for the next several years with that RHTP funding. And then, I think the current partnership with the National Association of Community Health Centers is another I'm really excited about. We've been very aligned with that group for a while, and to finally have a formal partnership where we're engaging actually on a grant with them to embed shared medical appointments and information and training into their stakeholder group, and to be working together on, joint initiatives to bring lifestyle medicine into community health centers across the country is just really exciting. So those are kind of the top three right now, but there's so many wonderful things going on always. We have an amazing staff. We have an amazing board of directors. We have wonderful members, many of whom are leaders in their own right. So it's just really, I feel like we're finally in a place where lifestyle medicine can really thrive for widespread adoption and implementation and access. And all of that really excites me. So. Yes,
I couldn't agree more. And we are grateful for you and your service. And thank you for your commitment to the field and ACLM. I appreciate you taking the time to join us today and share your insights. And thank you to our audience for tuning in to this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.